Johnson. I am a board certified anesthesiologist and board certified pain management physician with a specialty in regenerative medicine. The reason for my extensive line of credentialing will become a little bit more evident as I continue on with this presentation. At this point, you obviously have some interest in regenerative medicine and stem cell treatment, so you probably have some basic knowledge as to what it is and what it does. What I want to go into is just a couple of questions and some points of information that will help you in your decision of seeking regenerative medicine or stem cell treatment as an option for your current pains, strains, or problems. At this point, I'm going to address mainly 3 questions that people may have when searching out a stem cell provider. Number 1 question is, will this stem cell treatment work for me? This is a great question. I think it has several variables to it. Those variables include who is providing those stem cells, meaning which doctor, which provider is providing those stem cells, which types of stem cells are they using, and 3, how are those stem cells being placed? So to address the first part of this, who is providing those stem cells? Stem cell treatment is a relatively new field of medicine and is a highly specialized field of medicine. It usually is pertained to those who have high levels of training in order to do so. As a board certified pain management physician and a interventional doctor, I've been highly trained to do these procedures. Over the past 10 years, I have done thousands of injections into various parts of the body, including joints, the spine, various tendons and ligaments, muscles, and I've done hundreds of regenerative medicine procedures. The second part of this question is, what is the cell source? So there are several stem cell sources that are available today. You'll find that various people will advertise commercial sources of stem cells. There's a lot of controversy around those sources of stem cells. They are either labeled as umbilical or amniotic. We do not use those sources of stem cells in this clinic. In this clinic, we mainly use bone marrow aspirate concentration as a source of stem cells. We also provide regenerative medicine with the use of PRP. PRP, or platelet-rich plasma as it's known, is a growth factors and platelets that actually come from the person's blood. To address the third part of the question is, how are these stem cells placed? Well, stem cells should be placed with the use of some type of image guiding, whether that's a fluoroscopy, which is a type of x-ray that is used within the procedure room, or if it's done by ultrasound guidance. Usually if it's into a joint or another bony area, then the x-ray is the better source of image guiding. And if it's into the soft tissue, then the ultrasound is the best source or way to guide that placement of the stem cells. Another major question that is presented when people ask about stem cells is about the cost factor. But that cost factor does vary by several means as well. One is the source of the stem cells, whether that's PRP or bone marrow aspiration concentrate. 2, the site of injection. And 3, the number of treatments that are necessary. To address the probably the biggest question that's asked about stem cell treatment is this covered by my insurance? At this time, regenerative medicine or stem cell treatments are not covered by insurance. However, you can use your health savings account to cover these treatments. We also do provide financing through our office, which does not require a credit check and is available to everyone who applies. Your insurance, however, may cover a cost of a consultation, office visits, bracing, therapy that may be required before or after stem cell treatment. When you look at the total cost of stem cell treatment, you're again looking anywhere from $1,100 to $3,500 for a single treatment. Note that some people may require more than one treatment in their course of their stem cell treatment. When you consider the alternatives, then you're looking at factors such as resting, which some is promoted by some doctors for healing of certain tissues, which can keep you inactive for many months at a time. So you have to look at that cost factor. And if you look at surgery as an alternative, then you may be looking at thousands of dollars to meet your deductible, which most people now have high deductible insurance plans. And then you also have co-pays and cost of rehabilitation and things that may occur after surgery. And still you may potentially have significant downtime after surgery as well. The final question I want to answer in this brief presentation is, how long does stem cell therapy last and how long will it work for me? Well, the cells that are injected into a patient may last for up to 1 year, but we don't typically use the stem cells as the sole treatment of rehabilitation. So usually with the use of regenerative medicine, which does encompass both stem cell therapy and PRP therapy, we usually recommend some physical therapy, supplementations, exercise programs, keeping at an ideal body weight, which is going to be most beneficial for you and the regenerative medicine to have you more benefits for the long run. I thank you for taking these few moments to learn a little bit more about stem cell treatment and regenerative medicine. Again, my name is Dr. Tedrick Dunson, and I thank you for your time. Feel free to reach out to our clinic at 469-351-3432, or you can go to our website for more information. That is thrivepain.com.